Uganda was selected among 12 African countries to receive 18 million doses of the first ever malaria vaccine as a critical step forward in fighting one of the leading causes of death on the continent. The first allocation will run from 2023 to 2025, where Uganda will receive 1,750,000 doses of the vaccine, according to Dr. Daniel Chabayinze, the Director in charge of Public Health at the Ministry of Health.
Our roadmap shows that we've been preparing to receive these vaccines between now until April next year. In the whole country, in the whole world, the number of vaccines to be produced are limited. We want to give people 4 doses. So that means if we receive 1 million doses or 800,000 doses, we will be able to only vaccinate 250,000 children. So we are going to target, because the initial allocation framework from WHO shows that we can only access limited vaccines. So we've made a schedule where we shall first go to the places which have high malaria cases, and that is northern Uganda and eastern Uganda primarily now, or where other interventions have not penetrated exactly to the last child in every community. We need to be as equitable as possible.
Malaria kills about 18 people every day across the country. In Luwero district, for example, the General Hospital annual statistics show that the disease killed 70 people, while 13,070 people were admitted between January and December with malaria.
Like you've seen, it's almost 12% of what we really get as a OPD. 12% are people who are suffering from malaria. So yet the standard one is around 8. So we're seeing malaria is rampant, and every person who is coming, when we do the diagnosis, they is suffering from malaria. And these are the people only who come to the facility.
According to the World Health Organization, the vaccine has shown to be safe and effective in reducing severe malaria and deaths. Since 2019, Ghana, Kenya and Malawi have been delivering the vaccine through the Malaria Vaccine Implementation Program, resulting in the vaccination of more than 1.7 million children in the Phase 3 trial.
We shall start most likely at 9 months. And if not 9 months, we shall be like what Ghana did. They started at 12 months, when we do expect to have other vaccines. So we want to give these within the routine setting. Like when we know children are coming for other vaccines, that's when we shall give them. We had only one vaccine approved. Now in October this year, WHO added another vaccine. So R21 is another vaccine which has been approved, and for it the manufacturing capacity and availability has a larger volume which can be accessed. So Uganda is in transition, whereas we received approval and planned for the first vaccine. We are now also going to ask for the second vaccine, so that we can increase the number of people who can access this.
The vaccine will work alongside other interventions like indoor residue spraying and the use of mosquito nets. Dr. Chabayinze explains some of the expected effects of the jab.
Of course, with anything injectable, there can be side effects or effects in when you are injecting. Some people can get pain at the site of injection, and everything taking root into the body can give a small fever.
Uganda is among the top 10 malaria-burdened countries in the world, contributing 5% of all cases globally. Walter Mwesije, NTV.